Okay, my name is Madeline Hill, and I will be doing obesity and their environmental and cultural factors. Maybe. Okay, there it goes. So just to do a little recap. So the subject is the super obese. Um, by definition, the super obese is anyone with BMI of 50 and over. They're vulnerable because they can be greatly discriminated against in the healthcare, and by healthcare professionals. And a lot of health issues can be passed off as a result of their weight, which it might not be related to their weight. In the US, there are about 50,000 people who are super obese, and the US obesity rate is 31.9%. It's kind of hard to find information on the super obese. A lot of information that is out there is on just regular obesity. So Utah's obesity rate is 28.6%. It's more prevalent in minorities and people with lower incomes because Utah is predominantly white. That is why our obesity rates are lower. We also have a predominant faith group that has rules and guidances that encourage members to eat healthier. So in the media, I would say media portrayals can be about 50-50 nowadays. You do still have negative portrayal of health disparities. Things like the movie Shallow Hal. There are a lot of, I would say, in like pop culture, there's a lot of discrimination and negativity towards obesity. But then on the other side, you also have a lot more positive portrayal nowadays with body positivity and a lot of people pushing like anti-bullying. Inaccuracies are not very common, but they can be dangerous when they do occur. As far as family support, when it's positive, it can be really helpful. Positive family support can include encouragement for healthier living, and it can also create better mental health when the super obese feel like they're being supported and they are being encouraged to live healthier lives. It can make it easier to live healthier lives and to make those health changes that would be required. But there can also be negative family support. Which can lead to binging and other unhealthy eating habits, poor mental health if you have that negative family support, if your family members are being negative towards your weight or towards your eating habits, it can lead to depression and anxiety, which can also lead to your binging, your other unhealthy eating habits. So that negative support, or not support, but that negative family atmosphere can definitely affect it. No encouragement to better themselves, which means they're not making any progress towards a healthier lifestyle, which can also affect their weight and their health. Peers are typically they're pretty similar to family support. Same with being positive. They can be encouraging to these people to be living these healthier lifestyles and making these healthier decisions. They can also encourage more body positivity, which can more body positivity, which can better mental health, which can, obviously is good to have that better mental health. Lost my train of thought for a second. But when your friends give you that body positivity, encourage the body positivity, it definitely helps you. You feel better, you're better mental health. It may not necessarily help with the physical health side of things, but you always want to have good mental health. And then there's also the healthy eating groups, peers eating healthy with you, encouraging that healthy eating. Negative, there are always going to be friends that are not necessarily your friends, they are unkind. Definitely a lot of bullying that can go on with the obese community, which can affect mental health again. As far as this slide, there definitely can be genetic correlation with obesity. It's obviously not guaranteed. Not every single obese child has an obese parent, but definitely can be genetic. However, habits are very easily passed on. If children are seeing negative eating habits from parents and negative exercise habits from parents, it definitely is more easily passed on. Bad habits are very easy to pass on. Healthy eating and exercising are, however, influenceable. Again, children seeing healthy eating habits, it can be passed on. Children are very moldable and can be taught these healthy eating habits, healthy exercising. It can all definitely be passed on easily. We need to be teaching these children good eating and exercising habits. As far as the legal and political system, there are obesity grants. We have food stamps. Here in Utah, we have Wasatch Community Gardens, which can these community gardens can be used for lower income families who need easier access to healthier foods. And then we also have the Obesity Action Coalition here in Utah, which could definitely help as well. As far as potential barriers to the stigma, there are plenty of stigmas with obesity, but the main two that I feel like are very dominant are the correlation that obese people have poor personal hygiene, and then also that obese people are lazy. So those are the two that I feel like are the most common stigmas. As far as health disparities and the socioeconomic status, the low incomes can lead to poor eating habits. It can be hard. It can be hard because your grocery bill can definitely be more expensive than a fast food bill at times. High income, however, on the other side, high income can also lead to lower daily activity and higher calorie consumption. It can go both ways. So those high income people can definitely have that higher calorie consumption because they have that financial stability to buy what they want. And then I have this quote here: "Men with a middle class upbringing and lifestyle were almost as likely to be obese as those brought up in working poor households, but working now in lower status jobs." So, as far as race and ethnicity goes, non-Hispanic Black adults have the highest prevalence of obesity, followed by Hispanic adults and then non-Hispanic white adults in America. This is for all of America. So I have this little chart here that shows definitely down in the South is where our highest obesity rates are in America, which would make sense for the race and ethnicities that are down there. As far as religion, there isn't much religious correlation with obesity. The study that I did find did say that subjects who attend religious services 1 to 2 times a year and 1 to 3 times a month are associated with increased odds of reporting better health. However, this was more correlated with being white, and there wasn't necessarily a correlation with Black and Hispanic subjects, which, as we saw in the last slide, Black and Hispanic subjects are the ones that are typically more obese in America. As far as gender goes, the graph on the left is the entire United States. So as you can see, men are typically more obese than women in all categories except for the obese class 3, which is the highest, which would be closer to the super obese population that I'm technically covering, and that is women are more in the BMI 40 plus than the men. And then on the right side is a graph for Utah, which is, as you can see, typically the males are more obese than the females. As we have gone past the years, as you can see here in 2020, they've gone down to being almost the same, which is interesting. Geographical location: Utah is the 40th most obese state, which means we are low on the totem pole, which is good. Again, this graph over here on the right, this map, shows pretty similar to what one of those other graphs showed. Down there, that Bible Belt down the south is more obese. We are in the orange range, which is good. So yeah, so that, and then I couldn't find quite very much on Utah counties. They're all pretty similar. We're all pretty, the state as a whole is about the same amount obese. Bias, I found this quote, and it says, in addition to unconscious implicit bias, explicit bias is evident among healthcare workers or patients with obesity. Explicit bias refers to the attitudes and beliefs that a person has on a conscious level. In self-reported studies, physicians have characterized patients with obesity as being non-compliant, lazy, lacking in self-control, unsuccessful, and dishonest. Nurses also had self-reported descriptions that portrayed individuals with obesity as overindulgent, lazy, non-compliant, and unsuccessful. Healthcare providers need to consider obesity for what it is, a chronic disease, not a character flaw. So, obviously there's a lot of implicit and explicit bias with obesity, which is definitely something that as a healthcare worker and as a healthcare group, we could definitely do better on. And we could definitely improve the healthcare experience for the super obese. And here are my references. Thank you.